Okay, right now I'm just showing me driving through Boho, Philippines. I figured that this is much better than looking at some 60-year-old man talking. You're probably wondering if you should purchase or buy international health insurance if you're traveling to Thailand or the Philippines or somewhere overseas. The answer to this question is it depends. It depends on your situation. Now, what I'm going to tell you applies to original Medicare, Medicare Advantage plans, and, and Medicare supplement plans, which is also called Medigap. Medicare supplement plans has some limitations that neither original Medicare nor Medicare supplement or Medicare Advantage plans has. And I will cover this information more towards the end of the video. Now, if you are traveling to any other country like Thailand, the Philippines, Brazil, or any other country, Medicare will cover you or will pay for medical expenses under the following conditions. 1. You must be living in the United States or one of its territories, which means you need to keep your American address. 2. You're only covered for the first 60 days of travel. So if your trip lasts more than 60 days, then you may not have any coverage. Now, I do not know if they were asked for any proof that your trip only lasts for 60 days, because sometimes you can just drive down to Mexico or drive up to Canada. But you may want to keep any receipts you have of plane tickets, hotel stays, gas receipts, or something like that. 3. It will only cover you for emergency treatments. For example, I had a heart attack while I was in Thailand and I had to go to the emergency room. And because it was emergency treatment, I couldn't, get back to the United States in time, that was covered. However, if I had cancer, something that could wait until I got back to the United States for treatment, then that would not have been covered. 4. In most cases, you have to pay out of pocket and then get reimbursed by Medicare. So make sure you keep all receipts of hospital bills, and also try to keep a receipt of how you paid for the hospital bill, like credit card statement or your debit card statement. 5. You have up to 1 year or 12 months to file a claim and get reimbursed. But do not be surprised if Medicare only pays 80% of the cost, and so you might not get all the money back. For example, for Medicare supplement plans will only pay 80% of the cost. Medicare Advantage plans keep changing each year, and for some of these plans, we have different copays and different deductibles. However, if you're receiving both Medicare and Medicaid, I think your copay is only like $40, and you have no deductible. Plus, for Medicare supplement plans, also has a $250 deductible that must be paid first before you can get reimbursed for anything. Plus, Medicare supplement plans also has a lifetime limit of $50,000. Now, you might think that $50,000 is not a lot of money, but it's not true. $50,000 will cover you for almost any medical treatment overseas. Medical costs overseas is about 10% of the cost of what we pay here within the United States. For example, my heart attack, I had emergency room treatment. They put in a stent, and at the same time, I was in the hospital for about 4 days. And then with follow-up care, see the doctor after I got out the hospital, and with all the medication, only cost about $40,000. So, like I said, when you're overseas, medical costs and medical expenses is about 10% of what you're paid within the United States. So that $50,000 should cover you for almost all medical treatment. So once they stabilize you, it would probably be best to hop on a plane or come back to the United States for the follow-up treatment. This way, you're guaranteed that everything will be covered. Now, after 2020, any new person who enrolls in a Medicare supplement plan labeled C or F will not have any benefits regarding medical treatment overseas or in any other country. But if you were enrolled in one of those plans before 2020, you will still keep the same benefits of being able to obtain treatment and get reimbursed for any medical treatment you had overseas. Now, this does not apply to Medicare supplement plans D, G, M, and N. Those plans will not change after 2020. So any new person who is enrolled in one of those plans, which is D, G, M, and N, will still be able to get emergency treatment care and get reimbursed for that if you're overseas. Now, before I close, I also want to tell you that in Thailand, if you do not have insurance or if you cannot pay the medical bill or you're in a hospital and it is an emergency, then the Thai government has a fund called the Thai Fund that will pay for the hospital bill. Now, it won't pay for any follow-up care or follow-up treatment, but it will pay for, the cost while you're still in the hospital. Plus, if you do go to a hospital in Thailand, make sure, if you're able to, have an advocate, because some of those people in the hospital can be very aggressive, and they will take advantage of you or take advantage of your condition and try to get as much money out of you as possible. So it's best to have someone there to be able to advocate for you who's able to protect you. And that's about it. I hope this video helps. Adios.